Hey everybody, and welcome to another deep dive. Sometimes it feels like our hearts have a mind of their own,
Right.
right? Like they're doing this little dance, and we didn't get the memo on the steps,
Definitely.
especially as we get a little older, or for those taking care of aging loved ones. Those irregular heartbeats can be a real head-scratcher. So we're going to try and clear things up today.
Okay.
We're diving deep into the world of arrhythmias, with insights straight from the Texas Heart Institute. So, let's get this beat going.
All right. Sounds good.
To start us off, could you give us a quick breakdown of what arrhythmias actually are?
Yeah. So arrhythmias are basically irregular heartbeats.
Okay.
They can be too fast, too slow, or just completely out of sync.
Out of sync, like a broken metronome or something?
Exactly. Like a
Yeah.
musical rhythm that's gone a little haywire.
Okay, I like that. So too slow, too fast?
Yep.
But there are names for those, right?
Yeah. So when the heartbeat's too slow, we call that bradycardia. And that means less than 60 beats per minute.
Less than 60.
And then when it's too fast, that's tachycardia.
Tachycardia.
And that's over 100 beats per minute.
Got it. So bradycardia, slow, tachycardia, fast. What makes our heart decide to change tempo like that?
Well, it all comes down to the heart's electrical system.
Okay.
You see, the heart has its own natural pacemaker.
Oh yeah, I've heard of those.
It's a small group of cells that sends out electrical signals telling the heart when to beat.
So it's like the conductor of the heart orchestra.
Exactly. Now, with bradycardia, that signal can get weak or interrupted on its way to the ventricles.
The ventricles, remind me what those are again?
Those are the heart's main pumping chambers, the ones that do the heavy lifting.
Right, the powerhouses. So if the signal's weak or blocked, they don't get the message to pump at the right speed.
Exactly.
Okay, that makes sense. The source also mentions something about damage being a factor. What kind of damage are we talking about here?
Yeah, so we're talking about damage to the heart itself.
Okay.
Often from things like heart disease,
Right.
And aging is a big factor, too. As we get older, those electrical pathways can get a bit worn out, like old wiring.
Makes sense. Yeah. And are there other things besides age and heart disease that can cause damage?
Yeah, definitely. Certain medications can interfere with the heart's rhythm.
Oh, interesting.
And some people are born with conditions that affect their heart's electrical system.
So it's like a combination of wear and tear and sometimes just bad luck of the draw?
Sort of.
Okay, so we've covered the slowpokes, the bradycardia.
Yeah.
Let's move on to those speed demons, the tachycardia.
All right.
You mentioned there are different types of tachycardia, right?
Yeah, we divide them into two main categories. We have ventricular tachycardia,
Ventricular.
which starts in the ventricles, the lower chambers of the heart.
Yeah.
And then we have supraventricular tachycardia.
Supraventricular. So above the ventricles.
Exactly.
Okay, keeping it straight. Now, that ventricular tachycardia, the source described it as a rogue pacemaker taking over.
That sounds kind of scary.
Yeah, it can be. Imagine a rogue electrical signal in the heart
Right.
hijacking the normal rhythm and
Yeah.
causing the ventricles to beat too fast.
So it's like a mutiny in the heart's control room. Yeah, that's a good way to put it.
And what does that feel like for the person experiencing it?
Well, one of the most common symptoms is palpitations.
Palpitations.
That feeling of your heart pounding or fluttering in your chest.
Oh, yeah. I've definitely felt that before,
Yeah.
especially after one too many cups of coffee.
Right. But with ventricular tachycardia, the palpitations can be more intense, and they can be accompanied by other symptoms like dizziness, shortness of breath, even fainting.
Okay, now that's starting to sound more serious.
It can be. And the most dangerous type of ventricular tachycardia is ventricular fibrillation.
Ventricular fibrillation.
That's when the heart's electrical signals become completely chaotic.
Chaotic, so it's not even beating properly at that point.
Not effectively. It's more like quivering.
Quivering, wow.
And because the heart's not pumping blood properly, it can be fatal.
Fatal. Okay, so we need to take this seriously.
Absolutely. Ventricular fibrillation is a major cause of death from heart attacks.
And the Texas Heart Institute had some pretty sobering statistics on that, right?
They did. They estimated that ventricular fibrillation causes about 220,000 deaths each year.
Wow, that's a lot of people.
Yeah.
So what should you do if you suspect someone's experiencing ventricular fibrillation?
Call 911 immediately. This is a life-threatening emergency. And while you're waiting for help to arrive, start CPR if you know how.
CPR, and what about those defibrillators you see in public places?
Those can be lifesavers in this situation. They deliver an electrical shock to the heart to try and reset the rhythm.
So it's like hitting the reset button on the heart's electrical system.
Exactly.
Got it. So ventricular tachycardia can be really serious. But the source also mentioned something called premature ventricular contractions, or PVCs.
Right, PVCs are extra heartbeats that come from the ventricles.
Extra heartbeats.
Yeah, they're kind of like hiccups in the heart's rhythm.
Hiccups. So are those as dangerous as ventricular fibrillation?
Not usually. Most people experience PVCs from time to time, and they're completely harmless.
Okay.
But for people with underlying heart conditions, they can be a sign of something more serious.
I see. So it's like those skipped heartbeats you sometimes feel.
Exactly. Have you ever felt that?
Oh, yeah. Totally.
Yeah.
Happens to me sometimes, especially when I'm stressed or haven't slept well.
Right. Well, that could be PVCs. And sometimes things like caffeine or over-the-counter medications can trigger them too.
Huh. So even seemingly harmless things can mess with our heart's rhythm.
It's true. Our hearts are more sensitive than we realize.
Okay, good to know. So we've covered ventricular tachycardia and PVCs.
Hmm.
Now let's switch gears to that other type of tachycardia. You mentioned supraventricular tachycardia.
Okay, so supraventricular tachycardia starts above the ventricles, often in the upper chambers of the heart called the atria.
The atria.
Right?
And the source mentioned that supraventricular arrhythmias are generally less serious than ventricular ones.
Yeah, that's right. They're usually not life-threatening.
Okay, that's a bit of a relief.
Yeah.
But they still can cause problems, right?
Oh, yeah, definitely.
So what causes these supraventricular arrhythmias?
Well, there are a lot of potential culprits. Things like smoking, alcohol, caffeine, even stress can trigger them.
Ah, yes, the usual suspects.
And certain medications can play a role too, but there are also some specific medical conditions that can cause supraventricular arrhythmias.
Like what?
Things like rheumatic heart disease, an overactive thyroid, certain lung diseases.
So it's not always just lifestyle factors. Sometimes
Yeah.
it's something more complex going on.
Right.
Got it.
Yeah.
Okay, so what kind of symptoms should people be looking out for with these supraventricular arrhythmias?
Well, the most common ones are palpitations, shortness of breath, chest pressure, and a rapid pulse.
Those sound similar to the symptoms of ventricular tachycardia.
They can be, but with supraventricular tachycardia, the symptoms are usually less severe.
Less severe. Okay, good to know. So within this supraventricular category, are there any specific types of arrhythmias we should be aware of?
Yeah, there are a few key ones that are important to understand.
Nobody know me.
One is called supraventricular tachycardia, or SVT. It's a fast, regular rhythm that comes from the atria.
SVT. Got it.
And then there's atrial fibrillation, or AFib.
AFib. I've heard of that one.
That's a very common one, especially in older adults, and it's one we need to pay close attention to.
Why is that?
Because AFib increases the risk of stroke.
Stroke. That's serious.
It is. In fact, the CDC estimates that millions of Americans are living with AFib.
Wow. Millions.
And it's a major cause of stroke in older adults.
Okay, so AFib is definitely one to watch out for.
Mm.
Are there any other supraventricular arrhythmias we should know about?
Yeah, there's Wolff-Parkinson-White syndrome.
Wolff-Parkinson-White. Say that 3 times fast.
No, it's a mouthful. And then there's atrial flutter
Atrial flutter.
and premature atrial contractions, or PECs.
So many different types. It's like a whole zoo of arrhythmias.
Kind of. But don't worry too much about memorizing all the names.
Okay.
The key is to be aware of the symptoms and to see a doctor if you experience anything unusual.
Good advice. Now, what about that other thing the source mentioned, heart block? I think they called it a roadblock in the heart's electrical system.
Yeah, that's a good way to visualize
Okay,
it.
paint me a picture.
So with heart block, the electrical signals from the heart's natural pacemaker get slowed down or completely blocked as they travel through the heart.
And why does that happen?
Well, age is a big factor.
Age, yeah, can.
Those electrical pathways can become less efficient over time, kind of like old wires.
Makes sense.
And certain medical conditions can also cause heart block.
So there's like a traffic jam in the heart's electrical system.
Exactly. And just like with a traffic jam, the severity can vary.
Oh, so there are different degrees of heart block.
Yeah, there are 3 main degrees.
3 degrees. Okay, tell me more.
First-degree heart block is the mildest form. The signal is slowed down, but it still gets through.
Okay, so it's like a minor delay.
Right. Then there's second-degree heart block,
Second degree.
where some of the signals get through and some don't.
So it's like a lane closure on the electrical highway.
Exactly.
Yeah.
And this can cause skipped heartbeats.
Okay, and what about third degree?
Third-degree heart block is the most serious form.
Okay.
The electrical signal is completely blocked.
Completely blocked. Wow. So what happens then?
The ventricles have to rely on a backup pacemaker, which beats much slower.
Slower. So is that a problem?
It can be. This slow heart rate can cause problems like fatigue, dizziness, and fainting spells.
Fainting spells. So that's what they call Stokes-Adams attacks.
Exactly.
And in severe cases, it can even lead to heart failure.
That's right. So third-degree heart block definitely needs to be treated.
Okay. I'm starting to see why understanding these different degrees of heart block is so important.
It is. It helps us understand the severity of the condition and the potential complications.
Well, wow, we've covered a lot of ground here.
We have. It's a complex topic, but it's so important to understand.
Absolutely. Especially for our older listeners and those taking care of their aging loved ones. It's amazing how much our heart can get offbeat.
It is. It's a testament to how complex and intricate this organ really is.
Well said.
But remember, knowledge is power.
Knowledge is power.
And when it comes to heart health, the more we understand, the better equipped we are to take care of ourselves and our loved ones.
I couldn't agree more.
And we're just getting started.
Oh, really?
We still need to talk about how to recognize the signs of arrhythmias.
Oh, that's right.
And what to do if you or someone you love experiences any of these symptoms.
Well, I, for one, am ready to learn more. So let's dive back in. Okay, so we've talked about all these different types of arrhythmias, and it's honestly a little overwhelming.
Yeah, I can see how it can be a lot to take in.
But I guess the main takeaway here is awareness, right? Especially for our older listeners and their caregivers.
Exactly. You don't need to be a cardiologist.
Right.
But knowing the different types of arrhythmias, their causes, and most importantly, the symptoms, that can really make a difference.
So it's less about memorizing all the medical terms and more about knowing when something's off with your heart.
Precisely. It's about being able to say, hey, this fluttering in my chest, this isn't normal. Maybe I should get this checked out.
Okay, so it's all about being an advocate for your own health or the health of your loved one.
Exactly. And this deep dive, it's just a starting point.
A jumping off point.
If you have any concerns at all, please talk to your doctor.
Right.
They can give you personalized advice.
Yeah.
And figure out the best course of action.
Makes sense.
Yeah.
But I guess even having this basic understanding of arrhythmias can help you explain things to your doctor better, right?
Absolutely. The more informed you are, the better you can advocate for yourself.
Advocate for yourself.
That's a good point. Okay, so the Texas Heart Institute information really focused on the types and symptoms of arrhythmias.
Right.
But what about prevention? Is there anything people can do to lower their risk of developing these irregular rhythms in the first place?
That's a great question. And while you can't completely eliminate the risk, there are definitely things you can do to support a healthy heart rhythm.
Okay. I think our listeners are definitely going to want to know about that.
So first and foremost, maintaining a healthy weight is crucial.
Healthy weight.
When you're carrying extra weight, it puts more strain on your heart.
Makes sense. And that increases your risk of all sorts of heart problems, including arrhythmias.
So basically finding ways to get moving more.
Exactly.
Whether it's going for a walk, dancing, gardening, anything that gets your heart rate up.
Exactly. Aim for at least 30 minutes of moderate intensity exercise most days of the week.
30 minutes. Okay, I can do that.
It helps strengthen your heart muscle.
Right.
And improves your overall circulation.
Circulation.
Yeah.
Okay, good stuff. What about diet? Does that play a role too?
Huge role. Diet is crucial for heart health.
So what does a heart-healthy diet look like?
Well, think fruits and veggies.
Fruits and veggies.
Lots of them.
Okay.
Whole grains.
Right.
Lean protein.
Got it.
Healthy fats. And try to limit those processed foods.
Processed foods.
Sugary drinks.
Okay.
And too much saturated and trans fats.
So ditch the junk food and embrace the rainbow of fruits and vegetables.
Exactly.
Love it.
Yeah.
What about smoking and alcohol? Those are kind of the usual suspects when it comes to heart problems.
Yeah, smoking is a big no-no for heart health in general.
Yeah.
It damages your blood vessels. Right.
And increases your risk of a whole host of heart problems, including arrhythmias.
So quitting smoking is always a good idea.
Always. No matter how old you are.
And what about alcohol? Is a little bit okay.
Moderation is key.
Moderation.
Too much alcohol can weaken the heart muscle and increase the risk of arrhythmias.
Got it. So everything in moderation. We also talked about caffeine as a potential trigger for some people.
Right.
Any other things we should be mindful of in our daily lives?
You know, it really comes down to listening to your body.
Listening to your body.
If you notice that certain things trigger palpitations or irregular heartbeats, it might be worth cutting back or talking to your doctor about it.
Like keeping a diary of your symptoms and what you were doing beforehand.
Exactly. It's about being in tune with your heart's own rhythm.
Makes sense. Now, besides those lifestyle changes, are there any underlying health conditions that could contribute to arrhythmias?
Definitely. Things like high blood pressure, high cholesterol, diabetes, even sleep apnea. All those can affect your heart.
They can. They all put extra stress on your heart.
So working with your doctor to manage those conditions is really important.
It's like preventative maintenance for your heart.
Preventative maintenance. I like that.
Yeah.
And lastly, what about stress? Does that play a role in heart health?
Absolutely. Chronic stress is bad for your whole body, and your heart is no exception.
Right.
So finding healthy ways to manage stress is important.
Like what kind of things?
Exercise is a great stress reliever,
Exercise, yeah.
but also things like meditation, yoga, spending time in nature,
All good stuff.
whatever helps you relax and de-stress.
De-stress, absolutely. Now, for our listeners who are caring for aging loved ones, are there any specific things they should keep in mind?
As we age, our hearts naturally go through changes.
Changes, like what?
The heart muscle can stiffen a bit, the electrical pathways can slow down, and certain medications become more common, some of which can affect heart rhythm.
So it's important for caregivers to be aware of these changes and communicate openly with their loved one's doctor.
Exactly. Regular checkups are crucial.
Regular checkups.
Okay.
And if you notice any changes in your loved one's heart health, don't hesitate to bring it up with their doctor.
Good advice. So even with these age-related changes, many older adults can live long and healthy lives with well-managed arrhythmias.
Absolutely. It's all about proactive care and informed decision-making.
Well said. Okay, so we've covered a lot of ground in this section.
We have.
We talked about lifestyle changes, managing underlying health conditions, and the importance of open communication with your doctor.
It's a lot to take in.
It is. But I think the key takeaway here is that knowledge is power.
Absolutely.
The more we understand about arrhythmias, the better equipped we are to take care of ourselves and our loved ones.
Well said.
And this is just the beginning.
Right.
We still need to explore some of the exciting advancements in arrhythmia treatment and prevention.
The future of cardiology is looking bright.
Oh, I can't wait to hear about it.
Well, then let's dive into the future of heart health. Okay, so we've talked about the different types of arrhythmias, what causes them, the symptoms to watch out for, and even ways to prevent them. But before we wrap up, I'm curious, what does the future hold for dealing with these irregular heart rhythms?
That's a fantastic question. The field of cardiology is always advancing, and there are some really exciting developments on the horizon that could revolutionize how we diagnose, treat, and even prevent arrhythmias.
Okay, now you've got me intrigued. What are some of the most promising advancements you're seeing?
One area that's particularly exciting is wearable technology. Imagine a future where you can continuously monitor your heart rhythm throughout the day, not just during those brief doctor's visits.
So not just those snapshots we get at the doctor's office.
Exactly. This kind of continuous data could give us incredible insights into patterns and potential triggers for arrhythmias, leading to more personalized and effective treatment plans.
That's amazing. It's like having a personal cardiologist on your wrist, keeping an eye on things 24/7.
Exactly. Early detection is key when it comes to heart health. And these wearable devices are getting more sophisticated all the time. They can detect not only those obvious irregular heartbeats, but also subtle changes in heart rate variability, which can tell us even more about your cardiovascular health.
So it's not just about catching those dramatic offbeat rhythms, but also understanding those subtler fluctuations that might signal a potential problem.
Fascinating.
Precisely. And speaking of subtle changes, another area that's showing great promise is artificial intelligence, AI.
AI. Now, that's something I've been hearing a lot about lately.
For good reason, AI algorithms can analyze huge amounts of data, like electrocardiograms, medical records, even lifestyle information to identify patterns and predict the likelihood of developing an arrhythmia.
Wow, so AI could help us see those hidden connections and risk factors that we might not even be aware of.
Exactly. It's like having a superpower detective working behind the scenes to uncover clues about your heart health. And this is especially helpful for older adults who might have multiple underlying conditions that could contribute to arrhythmias. That makes a lot of sense. So we've got continuous monitoring and AI power detection. What about treatment? Are there any breakthroughs on that front?
Absolutely. Catheter ablation techniques have advanced tremendously. This minimally invasive procedure uses catheters to target and destroy the tiny areas of heart tissue that are causing those irregular electrical signals.
So it's like a pinpoint surgery for the heart.
Exactly. It's become incredibly precise and effective with shorter recovery times for patients.
That's fantastic news. A more targeted and less invasive approach. Who wouldn't want that? What about new medications? Anything promising in the pipeline?
Yes, definitely. Researchers are always working on new medications that are more targeted and have fewer side effects. Some of these new drugs work by blocking specific ion channels in the heart that contribute to arrhythmias, while others focus on improving the heart's overall electrical stability.
It sounds like the future of arrhythmia treatment is all about precision and personalization.
You hit the nail on the head. It's about moving away from that one-size-fits-all approach and tailoring treatments to each individual's unique needs and underlying conditions.
That makes a lot of sense.
Mhm.
Now, for the ultimate question, are there any advancements that could help us prevent arrhythmias altogether?
Ah, the holy grail of cardiology.
Right.
We're not quite there yet, but there are some very promising developments. For example, researchers are exploring the use of gene editing techniques to correct genetic mutations that can cause inherited arrhythmias.
Wow, gene editing. That sounds like something straight out of a science fiction movie.
It is cutting-edge stuff, and while it's still early days, it has incredible potential for preventing arrhythmias in future generations.
So from wearable monitors to AI-powered diagnosis and even gene editing therapies, it seems like the future of arrhythmia management is bursting with possibilities. It's mind-blowing to think about how far we've come and how much more we can achieve.
I completely agree. And the most inspiring part is that these advancements are empowering people to take control of their heart health, not just react to problems after they arise. It's a shift from reactive care to proactive prevention.
I love that. It's about moving beyond simply treating arrhythmias to preventing them in the first place, empowering people to live longer, healthier lives with strong and steady heartbeats.
Beautifully said. Ultimately, that's what it's all about, empowering individuals to live their lives to the fullest, knowing their hearts are in good hands, literally and figuratively.
Well, I think that's a perfect note to end on. We've covered so much in this deep dive into the world of arrhythmias, from the basics to the cutting edge. I hope our listeners feel informed and empowered to take charge of their heart health.
I do too. Remember, knowledge is power, and when it comes to your heart, every beat matters.
Thanks for joining us on this incredible journey, everyone. Until next time, stay curious, stay informed, and keep those hearts beating strong.